So I think we're good to get started. Thank you everyone again for joining us today. So this session is on my health record in specialist practice. My name is Brianna. I am a provider adoption lead here at the Australian Digital Health Agency. And I have a background in specialist practice management, working in public health across a couple of states in Australia, and have been working with health providers across the country in the uptake of some digital health tools, including My Health Record, which we'll be talking about today. So as we start, I'd like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. And I would like to acknowledge and extend that respect to any Aboriginal and Torres Strait Islander colleagues who may be joining us today. So just a bit of housekeeping as we get started today. You'll notice on your go-to platform control panel that you are muted. However, we do encourage you to ask questions throughout the session today if you have any, using the questions drop-down box, which will give you the ability to submit a question, and I'll be able to have a look at those throughout the session at a couple of key points and answer some questions. So please do engage and utilize that questions function throughout the session. If you would like to collapse the go-to platform, use the orange arrow, which will collapse your control panel, because if you press the X button, that will actually cancel you out of the webinar. So just using the arrow to collapse the control panel today. If you would like to receive or review a copy of today's session, we will be emailing out the recording along with a copy of the slides that we used today for you to review, and a range of other useful resources will be emailed out. So keep an eye out for your email over the next week for that follow-up email. If you would like to reach out after the session for any additional training for your organisation, feel free to contact us on the contact information that we will be providing later in the presentation. So my health record is one of these topics that we could certainly talk about for a very long time, and I won't bore you with a lot of that content today. So we will be doing quite a high level overview of the system. So of course, if you do have further questions, we will endeavour to reach out to you after the session if you just let us know. Okay, so I will now hand over to Joanne Thompson, who is here with us from St. Vincent's today. Joanne, over to you.
Thank you, Brianna. Welcome, everyone. We're so pleased you're able to join us tonight. Just to introduce myself, I'm the Director of Clinical Quality, Safety and Risk for the private hospitals in St. Vincent's Health Australia, so I have a national role. And I not only oversee quality, safety and risk management and other clinical areas, but also the clinical informatics systems in our hospitals. And I've been very closely involved in the implementation of My Health Record, particularly across our New South Wales and Victorian sites. So just to let you know that in Queensland, My Health Record in our private hospitals has been enabled since about 2016. We recently enabled access in our New South Wales private hospitals last August, and we're about to go live with uploading of our discharge summaries next week in our New South Wales hospitals, and then our medication profiles. In our Victorian hospitals, we enabled access of My Health Record earlier this month, and we hope to be able to move to uploading of discharge summaries later next month, and then medication profiles to follow. So it's a pretty exciting time for us. And we're very keen as we enable our access and uploading of documents in My Health Record to meet our legislative requirements of educating all our staff and people who want to access My Health Record. We've been partnering with the ADHA since February last year, and they have done a fantastic job helping us with education of all our staff and our VMOs. So it's a great opportunity for us to now launch our national VMO webinars. So again, welcome everyone tonight. And just to let you know, we do have in compliance with My Health Record education, we have our national SVHA My Health Record policy if anyone's interested. We've also developed a gap analysis in compliance with our National Standards Assessment Advisory from the Australian Commission. And for your interest, we've got a big year at St. Vincent's Health Australia private hospitals. 9 of our 10 hospitals are undergoing accreditation this year, and My Health Record is of particular interest to the assessors. So it's good that we are so well prepared. And in fact, we were nominated as an exemplar organisation by the Australian Commission a couple of months ago, and they met with us to better understand how well we have engaged with our staff. And we've identified that, you know, we see a bit of an opportunity for improvement with our VMOs, and that's why we're revisiting education in this space. If you require any information about My Health Record in our private hospitals that you visit, please don't hesitate to contact our quality, safety and risk managers or our clinical informatics managers, because they'd be only too happy to help you to see how to access My Health Records through DeLacy, etc. in the hospitals. So thanks again, everyone, for attending, and back to you, Brianna.
Thanks so much, Jo. It certainly has been a really great working relationship between the agency and St. Vincent's, and Jo and the team have been doing some incredible work with My Health Record at St. Vincent's. So thank you so much for that information, Jo. I will now jump into the presentation and we'll certainly make sure that I keep an eye on any questions that come through. So please do pop in any questions for those of you in the audience today. So when we start off talking about My Health Record, we always talk about the National Digital Health Strategy. And the National Digital Health Strategy and its roadmap for delivery was co-designed with all states and territories and agreed by a range of community and health provider consultation programs. So the agency has been tasked with improving health outcomes for Australians through the delivery of digital healthcare systems. And this is how the National Digital Health Strategy came about. These sort of 7 areas or 7 priority areas that you see on the screen have been established as the strategies to achieve implementation and delivery of these priority areas by 2022. And really, these priorities include information or health information that can be exchanged securely, available wherever and whenever, and standardized so that it can be shared in real time. And as you can see from the My Health Record strategy, so strategy number 1 on the far left-hand side of the screen, My Health Record supports health information to be available wherever and whenever it is needed. So moving on from the National Digital Health Strategy, a lot of work has gone into the implementation of this strategy through a range of peak organisations and state and jurisdictions, and we'll have a chat in a moment about the organisations across the country that are already connected, and so we can really understand the volume of the health system that is already connected into this system, but particularly the work that is being done with St. Vincent's has been a really great piece of work to support this National Digital Health Strategy as well. So what is the My Health Record? For those of us who may be new to My Health Record, a quick overview of the system. It is an online summary of an individual's key health information. So what we mean by that is that My Health Record is not designed to be a complete history of a patient's health. It's not designed to be a place where everyone and anyone can attach information about the patient, and it is really there as a summary of that key and crucial health information, so it can provide health providers with information that they might not have otherwise had access to. So we know that health information is shared in many various ways across the health system, and quite often we find that there's crucial health information that we're missing. And the My Health Record is purposed to be a decision support tool, to provide you with information that you might not have otherwise had access to, or that might have been quite burdensome or time consuming to get access to, so that you can make the best clinical decisions for your patients. It is personally controlled. So there are some key features of the My Health Record system in place to give consumers control over their own record. And we will touch on some of those a little bit later on in the presentation. It is part of a national system and it is accessible at all times. So where My Health Record is really unique is that when a patient moves between healthcare settings or moves throughout the country, the My Health Record goes with them. So this has proved to be really useful in times of crisis. So where we've seen floods and we've seen bushfires in Australia, and more recently with the COVID-19 pandemic, if people are where their usual health practitioner is not, or they're forced to see providers who they are not used to seeing or who are not their usual providers, those people can still gain timely access to their the patient's health information. And because it's accessible at all times, 24/7, it means that as a provider, I can log in and get information to that for that patient that I need at the time that I need it. So during the consultation, maybe right before the consultation or after the consultation, whenever it is that suits my workflow as a provider, I can go in and access that information. And I'm not relying on faxes or emails or things coming through. So we'll have a look at in a moment the types of documents that are currently available in the My Health Record and the volume of those documents sitting in patients' records as well. And finally, it is protected. There are multiple levels of best practice security protecting the My Health Record, including end-to-end encryption and firewalls, as well as the local storing of the data in Australia. And there is a cybersecurity centre that monitors the use of the system 24/7 to ensure that it is being used correctly and accurately. And there is also key pieces of legislation that underpin the security of the system. So the My Health Record Act and the My Health Record Rule are a couple of pieces of legislation that exist to support the security of the system. So how many documents are currently in the My Health Record at the moment? So the most recent stats show us that there are over 2.6 billion clinical documents currently up in patients' My Health Records. Now, 9 out of 10 Australians have a My Health Record, and that is a fairly significant proportion. If you think about 9 of 10 of your patients that you see already have a My Health Record, and 89% of those records already have clinical data in them. So your patients have these records, and these records have clinical data sitting in them already with over 2.6 billion documents. And we can see a range of different document types that are sitting in our patients' records, including clinical documents such as pathology and diagnostic imaging reports, a lot of information on medicines and allergies, information on the patient's diagnoses and medical history, as well as Medicare documents such as MBS and PBS claiming, air data, so immunization information, and consumers can upload their own information as well to contribute to their My Health Record, and that also provides or encourages better patient self-management as well. So as more and more providers across the country get connected, we're seeing a lot more documents continuously flowing through into the My Health Record system. So who are these healthcare providers that are connected to the system, and what documents are being uploaded? So we know that now 99% of all pharmacies across the country are connected to My Health Record, with 91% using. So this is where we're seeing a lot of really useful medicines information coming from our pharmacies, particularly what's called a dispense record. And we'll talk about that in a moment, but it's a really useful record where connected pharmacies, once they dispense medications to patients, that record actually automatically goes up to the patient's record in the background as part of their business as usual and part of their workflow. So we can see a lot of useful information about what our patients are actually being dispensed from our connected pharmacies. We can also see that 96% of general practitioners across the country or GP practices are connected to the My Health record, with 86% actually using the system actively. So again, majority of the general practice organizations across our country connected, and where we see really useful information from our GPs is around diagnosis, medications, immunizations of the patients, and it's particularly useful when displayed in a shared health summary. So that's the document type that is uploaded by patient's usual practitioner or their regular health provider. So whether that be the GP, it could also be a registered nurse or an authorised Aboriginal and Torres Strait Islander health worker. So I'll show you a screen snip of what that shared health summary actually looks like. But quite a lot of general practitioners actually uploading those shared health summaries for our patients as well. And 97% of all public hospitals across the country connected, with 95% using. So this is where we're seeing a great deal of discharge summaries coming through as patients are discharged from hospital. Again, an automatic process that has been set up through the software of that hospital, where these discharge summaries are getting automatically uploaded in the back end. So the same goes for some of our private hospitals as well. I think we're at about 65% of private hospitals across the country connected, with St. Vincent's being part of that group. And this is where we're seeing not only discharge summaries, but some of these other really useful documents that can be uploaded by hospitals in the back end. So the way the system works is when these documents are sent to the requester or sent to the intended provider, they're also automatically uploaded to the My Health record. So it's something that's been worked into everyday workflows without needing to be actively uploaded in many cases. So we can start to enable a lot of these documents going up without effort from the provider who's uploading it. Again, we can see our pathology and diagnostic imaging providers that are connected contributing greatly to that proportion of documents that we're seeing there. So 85 million pathology reports with 12 million diagnostic imaging reports already uploaded. And we will touch on providers who are uploading diagnostic imaging and pathology reports a little bit later on, but really useful in reducing the amount of duplication of testing that we're seeing across the system, and also reducing the amount of admin time that it takes for us to chase up some of these results in some cases, especially if you're seeing a patient maybe for the first time or a patient that's new to you and you don't have a great deal of information in those referral letters or in that patient's file, and they might tell you, I had a blood test recently or I had a scan. It can be quite hard to gather that information. So by going onto the patient's My Health record, we can also see in some cases those pathology diagnostic imaging reports. And again, our medicines information coming from a range of organisations across the health system. We're also working really closely with allied health professionals to get them connected to the system. Of course, a lot of work going into connecting specialists, and there are a range of supports available to specialists to get you connected if you are interested in learning more about connecting in your private practice, as well as how to use the system within the hospital system. So we'll certainly be focusing on that in today's session, and a lot of work also going into the aged care space and connecting more of our private hospitals as well. So let's have a look at the key functionalities of the My Health record system. And I've talked about a few of these document types already, but to visualize the available documents that can be uploaded, we've got them here on this screen for you today. So we can see on the right-hand side of the screen where we're looking at our provider uploaded documents. We can see right at the top that shared health summary, which again is really useful for when we're seeing a patient who may be new to us, or a patient who maybe has chronic and complex conditions, to get a great summary of what their active conditions are, what medications they're taking, their immunizations, and any history of procedures, that is the information that is collected and included in the shared health summary. And sorry, allergies as well as, of course, a really key and crucial part of that shared health summary. And that, again, is only uploaded by the usual provider. So only the regular GP, the regular nurse, or the regular Aboriginal and Torres Strait Islander health worker is actually eligible to upload that shared health summary. And that is information that can be really useful in trying to get a snapshot in time of that patient's health status. The discharge summaries, again, coming from a range of different hospitals, private or public, and can be really useful. There are a couple of ways that the discharge summary can appear in a patient's record, and we'll show you some examples of that in a moment. Our pathology and diagnostic imaging reports, a question that always comes up with these reports is, if it's in the patient's My Health record and they have access to it, will they be able to view their pathology and diagnostic imaging straight away? And the answer is no. There is what exists a 7-day rule. And that basically means that when the pathology or diagnostic imaging provider sends that report to the requesting clinician or to the intended recipients of the report, it will also automatically get uploaded to the My Health record in the back end if that pathology or diagnostic imaging provider is connected to the system. So once it gets uploaded to the patient's My Health record, it's actually not visible to the patient for 7 days. So while providers can access it and the requesting provider would receive the results in their normal workflows, none of their workflows would change. Once they receive that result, they have the 7 days to contact the patient as per your sort of usual procedures. So that has certainly been kept in mind. The only thing that is exclusive of that or does not include that rule is the COVID-19 pathology reports, which is available for patients to view in their My Health record after 24 hours. Also, event summaries are another option for providers to upload if they would like to detail a specific health event. So such as, wound management for nurses, or if there has been a significant event that they would like to contribute to the patient's My Health record, that can come in through the form of an event summary. That might come in from allied health professionals, any sort of healthcare provider involved in the patient's team can contribute to their record using an event summary. A lot of medicines information sitting in the system as well, coming in from prescription records, dispense records, as well as the pharmacist shared medicines list. And there is the provision for the uploading of specialist letters, which we'll touch on in a moment, as well as e-referrals and goals of care as well. So these are all provider uploaded documents. Now, what you'll see in the center of the screen here, so those 4 blue circles are what we refer to as our overview documents. So they are system generated. These are not uploaded by a single health provider. What the system does is it generates an overview according to each of these 4 topics so that we can easily and quickly summarize the information about these topics and view information for whatever is clinically meaningful to me. So if I look at the medicines information view, instead of needing to scroll through a range of documents that include medicines information to try and understand what that patient's medicine status is, I can go into my medicines view and the system will pull medicines information from a range of these documents that we're seeing uploaded by providers and list it for me in one really easy to access and easy to read view. So that's a great document, and we'll have a look at the medicines view in a moment. Similarly, we have the diagnostic imaging reports overview and the pathology reports overview. Again, it might be really time consuming to think I've got to go in and open each individual pathology report to see if that's what I'm looking for. So what the system does is it aggregates a overview document where all of those reports are pulled and listed for us so we can really quickly access whatever is clinically relevant to us. So those overviews, again, are really useful. And we have a Medicare overview as well, which contains some really useful information around that patient's, not only the services that they've been accessing through Medicare, but also PBS data and immunisation data as well. So we'll have a look at what that actually looks like in a moment as well. So aside from our provider uploaded documents and our really useful overviews of those documents, we can see that patients can also contribute to their own My Health record. It is really simple and clear where a patient has uploaded their own information. So it's not hard to miss, and they can put in their own health summary if they would like. They can also upload their own health notes, which are exclusive to them, so no providers can see those notes. It's just for patients and encourages self-management. And there is also the provision for patients to upload their own advanced care planning document. So that can be really useful for informing end-of-life care decisions, for the healthcare team to have access to the advanced care planning documents that the patient has uploaded. And you'll also see that the Services Australia system is also connected to My Health record. So when a patient is billed on MBS, or sorry, MBS is billed on behalf of the patient for a service that the patient has received, that information also flows into the patient's record. So that can be really useful in determining not only what services the patient has recently been receiving, but also who has been providing those services. So what other clinicians are the patient seeing? And that might help inform me on my clinical decision making for the patient, as well as sort of maybe understanding who else forms part of that patient's clinical team. And also, of course, the AIR records, or the Australian immunisation records, also do sit in the system. So let's start having a look at what some of these documents look like. So we can see here, this is an example of our shared health summary, and these are our 4 key areas that are included in the shared health summary. So the adverse reactions, medications, medical history, including any procedures, and immunisations. So a shared health summary is designed to be a snapshot in time of that patient's health status, to give us the most accurate information at this point in time under these 4 key headings. So you can only really have one accurate shared health summary at a time, because when a new one is created, it basically supersedes the last. So we only want to see one shared health summary at a time in the patient's health or in their record, and the latest shared health summary will always give us the most up-to-date information if the uploading provider is ensuring the quality of their data as well. So again, this is only uploaded by the usual provider, so the general practitioner, registered nurse, or Aboriginal and Torres Strait Islander health worker. And it certainly is designed to be that snapshot in time of that patient's health status. So we can see also at the bottom of the document a grey area here with administrative details. Now you'll see this on any document uploaded by a provider into the My Health record, and this allows you to get really useful information about who this provider is and their contact information. So any information that the system has will be included there for the patient and for other providers to easily view that admin information as well. So the medicines information, again, we can see from this list on the left-hand side that medicines info can be added to a patient's record through a range of different document types. So dispense records from pharmacies, prescription records coming from our GPs, from specialists, from any prescriber really can contribute prescription records if their system is set up to do so. Even our MBS from Services Australia data can contain medicines information through the PBS data. So all of these sources of medicines data can be really daunting to think about. So this is a example of what our medicines overview looks like. We've got 4 key areas across the top. So our allergies and adverse reactions is really easy to access first and foremost. And we know that this can be really useful for certain specialties. If you are unsure of the allergies and adverse reactions for your patients, it's certainly worth viewing and accessing My Health record, because you can certainly see allergies information, not just from one provider, but from a range of different providers that might have come across this patient and uploaded information into the system. So if the patient had a couple of allergies uploaded by the general practitioner and then recently had a stay in hospital where they picked up a new allergy, that may be visible through the patient's My Health record if that was uploaded to the system. So certainly a great place to look for that key information about your patient's allergies, as well as the medicines preview. So the medicines preview, again, is pulling all the information from all of these document types in regards to active medications the patient might be taking, and it lists it for us in one easy to access view. And certainly as well, we can access a range of other useful information for our patient from this overview document. So we hear from a lot of specialists that do use the system, and our early users of My Health records in specialist land, that when they're working off very little information for their patients, they love to go in and access the medicines view as their first initial point of contact. So when they go into the My Health record, the first document that they search for or they pick out is the medicines view, because it does provide this really useful information. The other thing you'll notice in the medicines view is it links the most recent shared health summary. And that is really useful, again, for that snapshot in time of the patient's health status, and it will always be the most recent linked in here in the medicines view. So highly recommend, if you are connected to the system and you are authorized to use the system, to certainly, when providing care to your patients, check out the medicines view. Now, allergies information being really important is certainly a priority and is very easily accessible in the patient's My Health record. And as we said, it is available in the medicines view, as well as in documents such as the shared health summary. But the medicines view is a really great one to look at because, as we said, it's not just showing us allergies information from one organization at one point in time, but it's showing us all the allergies information in that patient's record. So it's a really great place to look for allergies. Now, again, our hospitals can upload discharge summaries, and when hospitals have conformance softwares, that is a very streamlined process of uploading. So essentially, when that discharge summary gets sent over to the usual provider or the intended recipient, it is also uploaded to the My Health record in the background. So it's a really great document to know exists on the record, because as we know, having access to discharge summaries for our patients is really invaluable, and often we might not even be aware that the patients maybe recently had a hospital stay because we weren't on that recipient list for the discharge summary, or it might take us quite some time to get access to that. So certainly St. Vincent's through the DeLacy system has this functionality set up where those discharge summaries are going up, and so does quite a lot of other hospitals across the country as well. Now, the discharge summaries can look a couple of ways. They can either look like this, where they are in a template format, or they might also be an attachment as a PDF, which can be downloaded as well. Important to note that any information in the My Health record can be downloaded to your clinical system if it's new to you and you find that it is useful in your clinical decision making. And if you'd like to add it to your patient's local file, it can certainly be saved into your patient's file. And we'll touch on how that works in the clinical systems in a moment. Again, a look at our pathology reports overview. So here we can easily see the organization or the pathology provider lab that was conducted this test. We can see the date, we can see the test name. So is it a HbA1c, is it a full blood count, etc. And we can click on the report and open the report that's meaningful to us. So really great time saving, and again, really great in reducing the duplication of testing that we're seeing is so prevalent across the system. That's a really great one to keep in mind, and a very similar report will exist for the diagnostic imaging overview as well. And again, for our patients with chronic and complex conditions, or our patients who we know may be accessing pathology and diagnostic imaging services quite regularly for their conditions, this may be a really useful way of getting information quickly and easily. So in regards to diagnostic imaging and pathology providers, there is a list of the diagnostic imaging and pathology providers in Australia who are connected to My Health Record and uploading. So I'd highly recommend, if you would like to know which of those providers are near you or in your state or territory, have a look at that list. And some pathology labs will also utilize e-requesting, which means that the requesting provider needs to switch on e-requesting at their practice so that any requests that they give to their patients can be sent up to the My Health Record as well. And so there's a lot of work going on at the moment in the pathology and diagnostic imaging space to enhance the volume of documents that is being uploaded by these providers. Now, our Medicare documents, again, can be really useful in not only understanding the services that our patient is accessing, but also who the provider is. So as we can see here, a couple of examples, we can see the date that the MBS item was claimed. We can see the brief description as well as the item number itself and the service provider. So a great way to paint a picture of this patient's healthcare team. And currently in the Medicare overview is where the immunisation record sits. So the AIR record for our patient will flow into the Medicare document, but soon we will be seeing an enhanced view of the the immunisation data. So keep an eye out if you are a user of My Health Record or soon to be user for the immunisation overview, which will be a great way to see the most recent flu vaccinations as well as the COVID-19 vaccinations, whether they've had dose 1, dose 2, the date of those, and where they had them. So a really, really great summary of the patient's immunisation status also sitting in the patient's record. Here is an example of a specialist letter that may be uploaded, and again, with specialist softwares that are conformant with the My Health Record, this is something that happens in the background. So it's not going to be an active process where as a specialist you need to copy and paste the information or type it out twice or duplicate your workflow in any way. It's more of a system where you can tick send to My Health Record or not. So a really great example of a specialist letter here, and really useful for other members of the healthcare team to access to support that better coordination of patient care. So let's talk a little bit about authority to view My Health Record, and I can see this is one of the questions that's come through. So this is certainly a very important question to address when it comes to talking about using My Health Record as a provider. So providers are under no legal obligation to use the My Health Record system. It is simply there and available to clinicians to use according to his or her own clinical discretion. So it is up to you and your own judgment as to whether or not you would like to access My Health Record, but you are under no legal obligation to do so. It is really there, again, as we said, to add to the information that you have for your patient, and it is there as a decision support tool, really, for your clinical decision making. Now, we refer to what we call authority to view, and really that's referring to consent. So a provider is authorized by law to access a patient's My Health Record if they are authorized by their organization. So as a VMO at St. Vincent's, you may be authorized to access the My Health Record if you've done the relevant training. And so that criteria is satisfied. And then secondly, you simply need to be accessing My Health Record to provide healthcare to the patient. So if that patient is a patient of yours and you are accessing My Health Record for the provision of care, you have authority to view. So you do not need to gain written, verbal, or any other form of consent from your patient to access their My Health Record. You have what some people are used to refer to as standing consent, but we like to say authority to view. So no consent is needed as long as you are a member of that patient's care team or you are accessing their record to provide care to them. You have authority to view their record. And the same goes for authority to upload. The only times you would not have authority to upload is if the patient has specifically expressed that they do not want a document uploaded. Then you're not authorized to upload that document if the patient has said they don't want it to be uploaded. Certain states and territories do have specific requirements in some cases for the uploading of sensitive information. Again, I would recommend having a look at the policies of your organisation to determine whether that applies to you. And it is always best practice to ask the question to your patient if you are uploading a document such as a specialist letter, are you happy for me to share this on your My Health record? It is best practice, but you certainly are under no obligation to withhold that information. So having a look at the patient's control of their My Health record, as we said, a key feature of the system is that patients can control not only who has access to their record, but what information stays in their record. So there are a couple of options that patients can use to apply access controls. So the first one is what we refer to as an LDAC, or a Limited Document Access Code. It means that patients can hide documents that they feel are sensitive. So if there's a particular pathology result or a document that they do not want other providers looking at, they can apply an access code, which will allow them to share that with certain providers. And once they share that with that provider, the provider can use that code to access the full range of documents in the patient's record. A patient can also apply a full record access code, meaning that the record is locked unless you are a provider who the patient has shared the code with. So a patient can decide that they want only specific organisations to have access to their record, such as let's say their treating physician and their general practitioner, and they can share those codes with those providers, and once that is input into the system, it allows access to that provider for 3 years ongoing, and that allows a patient to control which providers have access to their record. Now, of course, it is important that in the event of an emergency that we can access patients' information that is crucial, such as medications and allergies and their diagnoses. So there is an emergency access provision. In the unlikely case that a patient has set a record access code, the provider can break glass or use the emergency function to override that code. Now, there is specific definitions for what constitutes an emergency, and we'll touch on that in a moment, but it is also really important to remember that at the moment, 0.2% of consumers actually have set any type of access code on their record. So very few consumers actually use access codes on their record, but certainly it is available for patients to use. And all instances of access to the My Health record are monitored and logged just to ensure the integrity of the system. And if we need to go back and investigate any potentially inappropriate use of the system, that those logs are available for auditing purposes. So in regards to what constitutes an emergency, again, in the unlikely scenario that a patient has set an access control and then, presents in an emergency situation, let's say that they collapse in your waiting room, and you need to know what allergies or conditions that they have, you can certainly break glass as long as it is according to this definition. So you can use that break glass provision if you reasonably believe that there is a serious threat to the life, health and safety of an individual, and it was unreasonable or impracticable to obtain their consent before doing so. Or if you believe that it is necessary to access this record to lessen or prevent serious threat to public health or public safety. So those are our definitions for accessing emergency access, and then the provider will have 3 days access to that record once they enable breaking glass. Now, having a think about all of the valuable documents that are sitting in My Health record and how that is meaningful to us in our specialist practices. We know from our consultation with specialists and working with specialists that a lot of the time there are a few clinical tasks that we find we are quite challenging or can be burdensome to get this information. So the first one being medication reconciliation and prescribing, sorting out our patients' medications, what they're on. Oftentimes they can't remember the name of the medications. Oftentimes the information that we have from other healthcare providers can be quite limited. So the medicines information view is a great solution to that in the My Health Record. The next one being history taking and patient assessment can either be quite difficult or quite time consuming. So having a look at documents like our shared health summary and discharge summary can be really useful in learning about what our recent health status of our patient is and any recent events or hospital stays. Again, avoiding that duplication of testing, including scans and diagnostics, being able to view that information, because often as specialists, we may not have been the requesters of those scans to begin with. So that means we're not sent the reports. So by being able to see those reports and not be the intended recipient is really, really useful in that care coordination and better management of our patients' health as well. And finally, informing end-of-life decisions. By patients being able to attach their own advanced care plans, we're able to support them better in honouring their wishes for their end-of-life care planning as well. So how can we utilise specialists? How can specialists utilise My Health Record in hospital settings? So as Joe mentioned earlier on in the session, the DeLacy system is what is connected in the St. Vincent's hospitals, and that is a conformant software or a hospital application that is already connected to the system. So here we can see in the blue on the left-hand side that providers can access the system in a couple of ways. They can view information by accessing the hospital application. So if you work across a range of different hospitals or a couple of different ones, St. Vincent's is an example of a hospital that has a conformant application that is inbuilt into the clinical software. So it's not a separate platform that you need to access. It's already in the system itself, and it's a matter of clicks to get you into the patient's record. And the second way is through the National Provider Portal. So if we're at a hospital or a setting where there is no conformant software, we can actually go online to a portal where we log in through our PRODA, where we can actually view patients' records there and have all the same information available to us through an online web browser. Now, the way that we upload information can only be done by clinical software. As you saw, those documents are actually conformed into or built into the clinical software so that there is minimal time needed to upload documents. It's actually data that's pulled from the clinical system to reduce the time that it takes to upload a document. So because of the conformant requirements of uploading documents, it needs to be done through one of these conformant applications. So if you have a conformant application, you can view and upload documents within your own clinical system. But if you don't, you can still view information through the National Provider Portal. Now, patients can also access their record, of course, and they can view information through their MyGov account and other authorised apps, and they can certainly upload and contribute to their record using their MyGov account. So in St. Vincent's, definitely, as Joe said, contact your clinical informatics manager or your quality manager in your organisation to find out how to access through DeLacy, or check the intranet, which often has information to support you at SVHA sites. You can also find out what documents are being uploaded and contributed to records through your hospital system as well. So highly recommend getting in touch with either your clinical informatics manager or your quality manager if you haven't already. In regards to private practice, how can we make My Health Record work? As we mentioned, we can either access My Health Record through the clinical information system, which is, we've got an example of one on the left-hand side of the screen, where it's built into our existing system. So if we use, for example, the Genie software, Best Practice, Medical Director, whatever software we use in our clinical or in our practices, have a look to see if that software is on the register of conformities. So at the bottom of the screen, there's a link to our website where we have listed all of the conformance softwares. And that means that you can access your patient's My Health Record through the software that you're using. And many of you might have already seen the My Health Record button or the My Health Record section of your own clinical software. So it is a matter of just getting connected to the system to switch that functionality on within your clinical software. If you don't have a conformance software, again, you can still jump online and access My Health Record through an online portal, which is called the National Provider Portal, and it's a very user-friendly and easy to access platform as well once you're connected. So in regards to the softwares, there are a range of softwares that are currently working with the agency to enhance their ability to connect with the system. So there's a table here, and again, you'll get sent these slides, so you can review these again if you would like, to show you the softwares that are conformant in the specialist space. And there is an industry offer out at the moment where the agency is working with vendors to produce more software for specialists to connect to the system. So a lot of work underway to better connect our specialists through their software. And some of the enhancements that we are going to see through some of the softwares, particularly through software for specialists, so S4S, which is Audit 4, medical objects, medical wizard clinical module. We're hoping to see the presentation of the medicines view, pathology view, as well as diagnostic imaging, the uploading of the specialist letters, and the uploading of the prescription records. So a lot of software is already having this functionality, and others coming on board soon to also include this functionality. So what are the next steps? This is sort of tying things up tonight, and then I'll get to some of the questions that have come through. The first thing is to ensure in my private practice that I have a My Health Record security and access policy in place. There are a range of really useful templates that do exist to support you with creating this policy. And in fact, there is one on the way from RACP. Then it's the process of getting connected. So registering for My Health Record as an organization and connecting as a provider to the system. There are a range of supports here at the agency and through other organizations such as your local primary health network, where you can get support in getting connected as a specialist in your private practice, either through your clinical software or using the National Provider Portal. So keep an eye out for the next steps, where I'll give you some resources of how you can touch base with us to get support for getting connected. The next step is training for all staff to ensure that everyone using the system understands what their obligations are for using the system, and making sure that it's being used in the right way. Certainly this is a requirement as part of SVHA for all users of My Health Record must undergo training. So this is a great thing that you've joined today. So you can tick off on some of that training as a starting point for accessing the system. And then also understanding what our ongoing participation obligations are as we continue to use the system as well. So that's all involved in a range of training resources. There are a range of resources available for ongoing training, including e-learning modules that do have CPD points attached to them, and so on. So in regards to the registration process, it's all done through your Proto account. So if you don't have a Proto account or you don't know what that is, have a look at it. It's through HPOS online. I'm sure majority of you already use a Proto and a HPOS, but this is the way that you would embark on getting connected and registered for My Health Record. And certainly there is that support provided to you from the agency and your local primary health network to help you through this process. So here is the information to access that support. help@digitalhealth.gov.au. Make sure you mention that you're a specialist and you'd like to get connected, and then someone will be in touch with you. Or you can call the 1300 number on your screen and ask for the specialist connection team. And we do have a team specifically purposed for supporting you and getting connected as specialists. Alternatively, you can contact your local primary health network. There is the link on the screen that you can access a PHN locator to work out the contact information of your local primary health network, which are also doing a lot of work to connect specialists in their region. We do have upcoming virtual classroom sessions, and these are really useful in, once we're connected, how do we actually use My Health Record in our own clinical software or in the portal? How do I navigate it? How do I view information, upload information? Every software has a different look and feel, so learning how to do that in your own software is really useful. So we've created these online sessions to take you through that training of actually once you get to the point of using. So I'll stop here at the useful resources and have a look at the questions that have come through so we can answer a couple. I can see somebody's put their hand up, and I'm sorry, just make sure if you've got your hand up and you've got a question, please pop it in the questions drop down. So there's a little arrow next to the word questions. Click on that, type your question in, and I'll be more than happy to answer that for you. So a question came through a bit earlier on about pathology and diagnostic imaging. So we've discussed the 7-day rule. If you missed that, when a pathology or diagnostic imaging lab or provider uploads that report, it is held in the patient's report for 7 days, so the patient cannot access it, but it is viewable to other providers in that time. So I hope that answers your question. Let me know if it doesn't. In regards to resources for, okay, so sharing this information with your practice managers, a really great question. Oftentimes, as clinicians, you're very, very time poor and don't often have the time to sort of sort through a lot of this information. So I would certainly recommend passing on the following resources to your practice managers. So here we've got the RACP curated collection for My Health Record, which is really useful. I'd highly recommend that yourselves and or your practice managers and practice staff have a look at the Digital Health Specialist Toolkit. It is a recent resource that's been developed in close consultation with specialists who use the system to support other specialists in not only understanding how to use My Health Record and how to implement that in their practice, but also other digital health tools such as electronic prescribing, secure messaging, and so on. So if you'd like information specifically for specialists in your practice, I certainly highly recommend having a look at this digital toolkit. It's just specialist-toolkit.digitalhealth.gov.au, and that will get you in. Alternatively, if you've got your phone, you can take a snip of that QR code on the screen now, and that will take you through to an mobile app version of the toolkit. There's some really great guides, implementation guides, and useful FAQs and fact sheets that can help you in navigating your next steps for using the system. And finally, some cybersecurity resources. So as I mentioned, the Cybersecurity Centre here at the agency monitors the My Health Record 24/7 and are responsible for ensuring that it is used appropriately and accurately. And they also have a range of really useful guides and resources for supporting you in your practice. As we get pushed towards more digital side of healthcare and using more digital health tools, it's really important that we understand cybersecurity and ensuring that we are keeping our patients and their data safe. So if you would like any more information about cybersecurity, I'd highly recommend having a look at the website there for that information. So I haven't seen any more questions come through. Please feel free to type any questions in the post-event questionnaire that we'll launch in just a moment as I finish up today's webinar. We will certainly get back to you if you have any questions. Please also indicate to us if you would like further training in your private practice, if you would like to learn how to use it in the hospital setting, and specifically for St. Vincent's, do contact your health informatics manager or your quality manager as well. If you would like to contact the agency directly, you can do so using the contact information on the screen, and keep up to date with the updates using our socials as well. Making sure if you do call the helpline, you select number 2 for providers, and that will get you straight through to somebody here at the agency. So thank you again for joining us today. I'd really encourage you to complete the evaluation form that is about to launch, and let us know if you would like any further support through that form, and also keep an eye out for that post-event email that you will receive with a copy of today's webinar recording and these slides as well. Thank you again for joining us this evening. We hope that this has been useful to you, and we look forward to seeing you next time. Thank you.